Hello, my name is Enid. I'm a health education assistant, and I am joined today by Lupe Bravo, Natividad diabetes specialist. Hi, Lupe. Thank you for joining us today.
Hi, Enid. Thank you for having me, and it's good to be here.
Today, we're going to talk about diabetes. Lupe, can you give us some context on how diabetes affects people in our community?
Well, we know that in Monterey County, 1 in 8 residents has diabetes compared to 1 in 11 on a national scale. It's estimated that about 140,000 have prediabetes, which is a serious health condition where blood sugar levels are higher than normal. This is about 45% of the county compared to 33% national.
I've been told that Latino populations are more at risk. Can you tell us a little bit more about that?
Yes, our Latino population is especially vulnerable. Monterey County is up to 60% Hispanic or Latinos, and the city of Salinas has 79%. While adults overall have a 40% chance of developing type 2 diabetes, but it's more than half in the Latino population and adults. They are likely to develop it at a younger age. Diabetes complications are higher in the Latino population also, with higher rates of kidney failure caused by the diabetes, as well as diabetes-related vision loss.
And we have a diabetes center here at Natividad that can help people navigate, diabetes. Tell me a little bit about our diabetes education center here at Natividad.
Yes, our Diabetes Education Center offers outpatient services to most everyone, children and adults with both type 1 and type 2 diabetes, gestational diabetes, and pre-diabetes. Our services are outpatient, which include individual counseling and education. Group counseling and education right now are on hold because of the COVID pandemic. We do community presentations and outreach when we're asked to do that. And services are provided by a registered nurse, which is me right now, certified diabetes care and education specialist, and a registered dietitian, nutritionist. They're available in English and Spanish and other languages, and we'll use interpreter lines if we need to or have interpreters here.
Great. Thank you for that, Lupe. And can you tell us how someone would go about finding out if they're at risk for diabetes?
Well, usually the easiest way is to get tested by their doctor, check their fasting blood sugar levels. And then there's a new test that they're doing, the A1C, that has been approved by the American Diabetes Association to diagnose people with diabetes. And a lot of times it's at their annual exams with their family doctors. And the normal ranges are under 125 or under. If it's over that, under 100 fasting, but anything between 100 and 125 milligrams per deciliter, that's considered a pre-diabetic state. And another thing, you go by symptoms too. Have you lost or gained weight? That's not unusual. That's not usual for you. You start urinating more often. You feel thirsty. Are you very tired? Blurred vision. Those are some of the symptoms you need to be on the lookout for. You want to let your doctor know immediately.
Thank you. And why is it so important to know your risk factors and know why you're at risk?
Well, we know that about 25% of the people with diabetes do not even know they have the disease, and that's dangerous. Uncontrolled diabetes, of course, can lead to all sorts of health issues, such as heart disease and strokes, kidney failure, vision loss, food damage, skin conditions, teeth and gum diseases, and other issues like digestive issues, sexual dysfunction, hearing impairment, which is something new that they're finding out more, and Alzheimer's disease. Those are all possible complications related to the diabetes.
Can you tell me, Lupe, what are the most important lifestyle changes someone can do if they are pre-diabetic?
They need to make choices and take some actions every day to manage their blood sugar levels. And the most important things are eating healthy foods, being physically active most days of the week, which is usually recommended 5 times a week, take medications if needed, and of course, getting regular checkups. Usually most people will go about every 3 months when they have diabetes, every 6 to annual if they have pre-diabetes.
And we talked a little bit about how diabetes affects Latino population. Can you tell me a little bit more how they should go about managing this disease?
Well, diabetes in itself is a condition that is very challenging for anyone to manage. But those in the Latino population many times face additional barriers, which could be communication, understanding their doctor, if they speak another language, don't understand the values and preferences, um, or they don't know about following the treatments, don't understand what the doctors are telling them, and then also trying to make the lifestyle changes that we recommend. Food, which is a big one for our community. Usually there's a little bit more fat, more frying. Of course, that comes with more calories. And then you have the frequent family celebrations where, it's not very polite to say no. Or you have to have the soda, or they think water, why are you just having water? Little things that they have to make choices. So they'll just eat what's there. And of course, weight, we know there's a higher rate of obesity in the Latino population, usually because they tend to be less active, or they don't know the importance of it. So just being overweight can bring on a lot of health problems, including hypertension, high cholesterol, and then of course the diabetes. So that's why we're gearing our center is geared towards showing them how to make lifestyle changes and a long-term area. Yeah.
Well, thank you so much, Lupe. You've given us very valuable information today, and thank you very much for your time.
Thank you, Enid. Thanks for having me again.